Good evening. My name is Daniel Moore. I'm a student at Alcorn State University Nurse Practitioner Program. Today I'm going to be conducting a small focused assessment and interview a health history with a patient. Ma'am, can you state your name and age for me?
Candace Moore, and I'm 25.
Okay, I'm going to ask you a few questions just to get a brief health history. Normally we would get a chief complaint, and since there's nothing wrong with the patient today, we're just going to do it as a well checkup. Are you feeling okay today?
Yeah, I feel good.
Okay, good deal. I'm going to ask you a couple questions about your health history. Do you have any chronic illnesses such as hypertension, diabetes, anything like that?
No.
Okay, good. Are you allergic to any medications or anything at all?
No.
Okay, good deal. What about your immunizations? Are you up to date on those?
Mm-hmm.
You got your flu shot this year?
I did.
Have you had a tetanus shot in the last 5 years?
I have.
Okay, good deal. Normally at this point, if the patient was over 60 years old, we would ask the patient if they've had a pneumovax or a herpes zoster. But since the patient's 25, she's had her flu and she's up to date on her tetanus and all of her other immunizations. She seems fine. Do you take any regular medicines or even over-the-counter medicines?
Just birth control every night.
Okay, all right. Have you ever had any major surgeries or hospitalizations?
No.
Okay, good deal. What about caffeine? Do you drink any caffeine?
About a cup of coffee a day, yeah.
Okay, what about tobacco?
No.
No tobacco, okay. What about street drugs, marijuana?
No.
Alcohol?
No.
Okay, all right. Very good. Let's talk about your family history a little bit. Let's talk about your mother. Does she have any chronic illnesses or any histories of anything significant?
Yeah, she has hypertension and high cholesterol.
Okay, what about on your maternal grandparents' side? Anything there?
No.
Okay, and how about your father?
He has hypertension.
Okay, and his grandparents?
My grandmother had Alzheimer's.
Okay, all right, so family history of Alzheimer's, otherwise negative. Do you have any siblings that have had any sort of childhood illnesses or anything like that?
No.
All right, how about you, childhood illnesses?
I had chicken pox.
Chicken pox, okay. All right, that's very good. All right, now that we've gone through that, I'm going to ask you a couple other questions. How many hours of sleep do you get on average per night?
About 6 to 8 hours.
Okay, what about your exercise habits?
About 30 minutes, 2 to 3 days a week.
Okay, good deal. So you sleep 8 hours a night per se, and you exercise 30 minutes or so twice a week?
Mm-hmm.
Are you on any kind of special diets like gluten-free or low carb or anything like that?
No.
Okay, all right. Now that we've conducted the patient's history, we're going to start with our assessment. All right, we're going to start with the nasal cavity and the sinuses. All right. All right. First, we're going to inspect the nose. We're going to look for symmetry, any lesions, anything out of the ordinary. All right. So we're going to inspect inside the nasal vault. Everything seems to be symmetrical and pink. No secretions noted. If you did have secretions, you'd want to note consistency, color, anything to help you identify them. All right. Septum looks symmetrical. All right. Now we're going to test patency. Ma'am, if you could cover one nostril and blow for me. Good, good. Seems like the left nostril is patent. Let's do the right now. All right. Any problems there?
No.
Okay, good, good. All right. Now, next we're going to do something called transillumination. All right. Well, first I want to palpate your sinuses. I want you to tell me if they're tender, if this hurts any, okay? All right. Now we're going to palpate the frontal sinuses. Any pain, any tenderness there?
No.
All right. And then the maxillary? Any pain or tenderness?
No.
Okay, good. Next we're going to do something called transillumination. All right. And this will give us an idea of if the sinuses are congested or not. So what we're going to place the light under the patient's brow. All right, and we're going to cup our hands here. Normally, you want to do this in a dark room, and you're looking for a warm glow right above the eyebrow and the frontal sinuses. All right, good deal. All right, now we're going to do the maxillary, and you want to place it on the cheekbone. Can you open your mouth for me? All right, you want to see a nice warm red glow on the palate. All right. Can you open your mouth for me? Good, good. I can see that. Okay. All right, now we're going to test the olfactory. Can you close your eyes and tell me what this smells like?
Like sweet perfume.
Okay, good. That is correct. That's correct. All right. Next, we're going going to examine the oral cavity, and in doing so, we're going to put on some gloves. I'd also like to state for the record that we perform hand hygiene before press and record. It's always important to perform hand hygiene before conducting your examination. All right, first we're going to examine the outside, the lips. All right, they're pink and moist, no lesions noted, everything looks symmetrical. If there was any dryness or cracking, that would be indicative of dehydration. Any type of blue coloration might be indicative of cyanosis. So we're going to feel the lips. They're pink and moist. Good deal. Okay, ma'am. Now can you open your mouth for me? Okay, just show me your teeth. Good deal. Okay, now we're going to inspect dentition. As you can see, the patient isn't missing any teeth. All right, gums are pink and moist. Mucosa pink and moist. Everything looks as it should. All right, can you open your mouth for me? All right, good. I'm going to examine the hard palate and the soft palate. Everything is pink and moist and symmetrical, no secretions, no erythema, or should I say secretions are clear and minimal as they should be. All right, can you say ah for me real big? Okay, good. This is testing cranial nerve 10. I'm looking for the rise and fall of the uvula, and also in doing so, I'm examining the tonsils. They are pink and within normal limits. There's no exudate noted from the tonsils in the pharynx or the uvula. All right. Thank you very much. Okay, now that we have assessed that, we're going to test their cranial nerves. All right. We've done 10 when you said ah. We had the rise and fall of the uvula. Okay. Now we're going to test 9. I like to. The posterior third of the tongue is the 9th cranial nerve. It senses bitterness. So I'm going to touch something to the back of your tongue, and I want you to tell me what it tastes like. Okay? Can you say ah for me? Can you stick your tongue out? Good. All right. Thank you very much. What's that taste like?
Bitter.
Okay. Good deal. Good deal. All right. Now we're going to assess cranial nerve 12. I want you to stick your tongue out for me. Okay. All right. Can you push up? Good. Okay. Can you move your tongue around a little bit? There we go. Good. That's the glossopharyngeal, and it shows us that it's within normal limits. All right. If you could lie back on the bed for me now, we're going to assess the abdomen. All right. All right. When assessing the abdomen, first you want to inspect. You can lift your shirt up for me, ma'am, so about right here. Just a little. Thank you very much. All right, we're going to inspect the abdomen first. We're looking for symmetry. We're going to look at the umbilicus. We're looking for any pulsations, any abnormal rise and fall of the stomach, any distension, any discoloration. The skin is warm and, well, I haven't touched it yet, but it's pink and as it should be. No abnormalities are noted. All right, I'm just going to watch. I'm looking for pulsations, anything abnormal. I'm looking for piercings, maybe an extroverted umbilicus, anything abnormal, really. All right, now that I've inspected, all right, I'm going to listen. All right, now, normally you want to listen for at least 2 minutes in each quadrant before you determine that there are no vowel sounds, and 5 minutes altogether. So we're going to go ahead and we're going to start in the left upper quadrant, and we're going to listen for vowel sounds. All right, vowel sounds are active. In the left lower as well. Good. And then the right lower. And then the right upper. Okay, good. While I'm here, I'm going to go ahead and listen for the renal and splenic arteries. And normally you'd auscultate with the bell end of the stethoscope, but mine functions the same way. You just have to press down a little harder. And what I'm looking for is a whoosh sound or a bruit that would be indicative of some sort of aneurysm or abnormality and would require further investigation. All right, I'm going to listen to this side on the renal artery. All right, no bruise noted, okay? Now we're going to percuss, okay? The hollow sound we hear when we percuss is referred to as tympany, and that's what you should hear, the sound you should hear in all 4 quadrants. So I'm going to percuss the left upper, and then the left lower, and the right lower, then the right upper. All right. Normal Tiffany sound in all 4 quadrants. Okay, now I'm going to try to determine the borders of the liver. And in order to do that, I would percuss from Tiffany until where I hear dullness. There it is. It's right there, just under the rib. Okay, so now I'm going to keep percussing all the way up until I hear Tiffany again. And it should be about the 5th intercostal space. And you would measure that. And normal findings for liver size is 8 to 10 centimeters. All right, now we're going to come and percuss the spleen. All right, and what I hear is dullness there. Okay, now that we've percussed, we're going to lightly palpate. We want to observe the patient's face the entire time for any signs of tenderness or discomfort. This will let us know of any abnormal findings. So, ma'am, do you feel any pain?
No.
Okay, good. If you have a patient who is obese, you may have to use bimanual palpation. All right. Abdomen is warm and non-tender in the left upper and left lower quadrants. What about the right lower? Any tenderness there?
No.
Okay, good. What about there?
No.
All right. In some cases, you can palpate the liver border with deep palpation. We're going to go ahead and start with our deep palpation. Any tenderness there?
No.
Okay. I can feel the border of the liver there. All right. Any pain or tenderness there?
No.
Okay, good. What about there?
No.
Okay. And in the left upper?
No.
Okay, so no tenderness in any of the 4 quadrants with deep palpation. You will also want to palpate the epigastric area. Any tenderness there?
No.
Okay, good. All right. All right, now that we have inspected, auscultated, percussed, and palpated, the only thing left to do is to check for CVA, costovertebral angle, tenderness. So, ma'am, if you would mind, would you sit on the side of the bed just like this? Here, let me help you up. Just right over here. There we go. All right. Now, what you're looking for is right here at the bottom of the ribs, in the back, is the costovertebral angle, about where the kidneys are. Now, tell me if you feel any tenderness. Any pain or tenderness?
No.
All right.
No.
Nothing?
No.
Okay. All right. All of our findings today were within normal limits. No abnormalities. Nothing significant that would require further investigation. Ma'am, I'd like to thank you very much for taking part in my assessment. And again, this will be viewed by my fellow students and my instructors. And that's all right with you?
Yes.
All right. Thank you very much.